Hey, it's Erin, your ER educator, and today we're going to look at the 3M Ranger Fluid Warmer. Objectives, we are going to review the indications for the 3M Ranger Fluid Warmer. We're going to watch the manufacturer video, and you can do that at any time. It's a great video, and I'll kind of show you when to start that so you can kind of skip some of the non-important things. We're going to look at the setup, we're going to look at the equipment that you need, and then how to disassemble it after you're done using it, and then just some extra tips for use. All right, so the 3M Ranger fluid and blood warming system is designed to warm blood products, and liquids and deliver these at a flow rate, a certain flow rate. You can deliver them anywhere from just TKO up to 500 milliliters a minute. So it can actually infuse pretty darn quick. And then at these flow rates, the device maintains a fluid temperature ranging from 33 to 41 degrees Celsius, which is equivalent of 91.4 Fahrenheit to 105.8 Fahrenheit. When you turn the machine on, it will auto set the temperature to that 41 degrees Celsius. So it'll get it up to 105.8 Fahrenheit. So again, we want to use this anytime we are going to be quickly infusing blood products or IV fluids. So I'd like you to take a minute and watch the video. We're not going to watch it during this recorded session, but I think it's a really good video to watch. I've also included it in the Donnerwright competencies, but you want to start this at 55 seconds, and the video goes through setup, how to set it up, the equipment that you need, how to run it, and then how to disassemble it. It's fantastic. I highly recommend it. All right, so let's set up the fluid warmer. So first things first, grab the Ranger, and you want to adjust it on the IV pole and secure it in place. It should be at the patient level or lower to help prevent the risk of air embolism, and then make sure the Ranger is plugged into a red emergency outlet. Next up, let's look at the fluid warming set itself. So as you can see in the picture, it's got two bag spikes. So you can set it up for fluids and blood. You don't need any special tubing. You don't need any extra special blood tubing. It's all set up and ready to go. Everything has luer lock connections, so as soon as you take this thing out of the package, make sure you tighten all those luer lock connections. Then you've got your drip chamber with filter, which then has a roller clamp. And that's important to note that there are two roller clamps on the device, and you want to make sure once everything is primed that you have those things secured, and we'll talk about that in a second. You have a blue inlet pinch clamp, and that is before the cassette. You also have then the fluid warming cassette that goes into the machine. You have your auto venting bubble trap, which hangs on the side of the machine. You've got your white outlet pinch clamp, which is below the cassette. And then you've got another roller clamp. You've got an injection port. You have the white outlet clamp, the patient connection, and then again, I'll show you the bubble trap holder, which is on the side of the machine. So this is just the components of the high flow set. This is what you would see as soon as you open up our warming set pouch. So reminder, as soon as you take that thing out of its pouch, make sure you tighten all your luer lock connections. Before priming, you're going to put the warming cassette into the machine. Then you're going to place the auto venting bubble trap into the holder on the right side of the machine, which you can see in the bottom right hand picture. Once it's in the machine and you've got your bubble trap on the side of the machine, close the clamp below the auto venting bubble trap. Okay, so that's going to be the one closer to the patient. Then make sure you close the two clamps below the fluid source spikes. So those are the ones that go up to your blood or your bag. And then you want to connect the short inlet line to the fluid source. So as you can see in the picture, we're going to be closing those clamps below the fluid source, and then you want to spike your bag. Next, you want to prime your tubing to purge air from the line. So make sure you invert the bubble trap and fill that puppy up too. Once the bubble trap is filled, put it back on the machine and secure it to the trap holder. Then make sure you close all your clamps after the entire line is primed, otherwise you are going to rapidly put fluid onto the floor. Make sure that you attach the patient end of the tubing to an extension set if it's needed, and make sure that that is primed as well. And then connect the primed tubing to the patient. Once everything is primed, make sure to turn the warming unit on, and it will automatically default to 41 degrees Celsius, which is 105 Fahrenheit. And once it's warmed, you can start your infusion. So when you're all done with the fluid warmer, make sure that you kind of follow these steps so you can remove it properly. So close all the clamps above the warming cassette. Make sure then to open all the clamps below the warming cassette. At this point, with all the clamps open below the warming cassette, you are going to purge the line. So allow fluid to flow into the patient for about 2 to 3 seconds. Make sure not to allow air in there, but make sure the patient gets all the blood or fluid that's left. Just be mindful of that. Once it's emptied, close the outlet clamp below the bubble trap, and then remove the bubble trap from the side of the machine, remove the cassette from the machine, and then dispose of the cassette, following your facility's protocols. So, just some tips for use. Always be watching the IV fluid bag and be ready to change it. In my experience, I've always thought it's been best that you have one person kind of dedicated to doing the Ranger, just because it does infuse so fast. You almost need, 1-to-1 with a nurse in just this thing so you can keep track of it. And then to reduce the risk of leaking and fluid and blood loss, make sure that you don't exceed 300 millimeters of mercury of pressure while infusing. So make sure that you've got your pressure bag at 300 but not any higher. And then don't remove the warming cassette while it's in use. You have to make sure that you purge the line, and I'll talk about that shortly. And then another thing to think about is after every 2 bags of crystalloids, the nurse really should be asking the doc at that point if blood products should be ordered. Especially for a trauma or a blood loss patient. The last thing we want to do is cause dilution, so it's really important. If you all remember from TNCC, we really should be infusing at a 1-to-1 ratio. So if you are giving lots and lots of crystalloids and it's a trauma or a blood loss patient, we really should be infusing blood as well, because we don't want to dilute our patients' low blood stores. So we really should be thinking about blood products. After each use, make sure that you remove all the tubing per the manufacturer recommendations. Place the tubing and the bags in the biohazard bags if blood products were used, and then make sure to wipe down the infuser. So hopefully that was helpful. Hopefully it was just a quick little reminder. Like I said, if you are a visual person, I highly recommend just watching the video. And then don't forget, it is also in the RN skills binder at the desk if you ever need to, just quickly reference things too.